Hey guys, it's Dr. Abraham with A Sip of Aesthetics. I'm sitting here with Lindsey today. How are you doing?
Hi, good. I'm so happy to be back here.
Great to have you back. We've actually had a few episodes together, and we had a couple questions. And I know there's even people who are watching who are just interested in the field in general, or they're kind of thinking of what goes behind the scenes, what kind of made you want to go in that kind of field. So maybe we can talk a little bit about that to start the
Yes,
episode.
definitely. I know. I feel like every nursing student, PA student, med student, all has not everybody, but so many of them tell me that they have an interest in aesthetics. And it really is like this Renaissance movement that's happening that is just so interesting to people.
So let's talk a little bit about your background. Did you always kind of know you were going into that field? When did it happen? When you started school, or did you have a different kind of pathway in mind?
I was the daughter of a nurse, and my mom worked in the hospital on like a med surge floor. And Botox became kind of popular when I was about 12 years old. And I think my mom was like the first person in line to go get it. And she was so excited about it, came home and looked at me with a serious face and said, Lindsey, you could grow up to be a Botox injector someday. And I was like, literally, leave me alone. You're psycho. And no, I'm not interested. But she always had that like excitement about it. So I always appreciated that. And it made me kind of excited or happy that she was so, into it. And fast forward now, all of her dreams have come true, and I'm a Botox injector. But really, throughout high school and even middle school, I suffered severely from acne. I had to be on Accutane multiple rounds. I was constantly seeing a dermatologist on different medications, having to do treatments. And then, kind of towards the end of high school, started doing things to repair my skin. And my doctors all along the way truly were like very comforting to me, helped change my life basically by helping me with this suffering. And so I always really appreciated that aspect of it. And then I went to school at Colorado State for undergrad, kind of did a pre-med. I didn't know exactly what field I wanted to go into. Decided I wanted to become a physician assistant, went to PA school at USC, which brought me to California, and then always had an interest in services that I could perform little procedures. And I really loved surgery. I loved whatever procedure in the emergency room. And then I did have a rotation where they had a med spa too. And that all interested me. But I always wanted to fulfill kind of like general medicine route and do aesthetics, which is exactly what I did. And so, like the first day that I graduated, I wanted to kind of balance my life by I did emergency medicine, and then I would work like a day or two a week in a med spa just to get familiar with it. It's like a different kind of style where you build relationships long term in the med spa, which I like, whereas in the ER, it's these very short term interactions. And the only people you really build relationships with are the like frequent flyers that are interesting. But so I went into both fields right away. And I feel like as a provider now, I have such a better understanding of people's overall health, their needs, their medical backgrounds, and kind of just working with all different types of people, socioeconomic statuses, and can really connect with people because I worked in the emergency room as well. But as soon as I started getting training in aesthetics, I absolutely loved it. And like I experienced, I've had multiple people tell me that I've changed their life because they feel better about themselves, they feel more confident, or we've kind of addressed something that they've been suffering from for a long time. So it is very fulfilling.
Wow, so you found your calling at an early age, thanks to your
Oh
mom.
yeah. Thanks, Mom.
Where'd you move from? Because you said you came to California when you came to
Yep,
USC. Where'd you
I
grow up?
was born and raised in Colorado. So right outside of Boulder, Colorado is a town called Longmont,
Yeah.
and I lived there my entire life. It's kind of a farm town, and then grew up in Colorado, went to college in Colorado, and then applied to PA school and got into USC, came out here.
So now that
Stayed.
your mother's dream had come true, does she come by to get injected by you?
She
Or do you
sure
go?
does. She's very loyal to her injector in Colorado, which, alluding to a past episode, I have like some red flags about her injector, which sometimes I have to dissolve her treatment. But she's very loyal to her person, and then when she comes out here, we do whatever we do, and she just is so happy.
Awesome. So once you started with the emergency room and going and doing aesthetics kind of on the side, how long was it before, like did you do the emergency room for a while, or was it like relatively quickly that you're like, okay, no, this is what I like? Because they're very different fields. The reason I'm
Yeah.
asking. And some people, are more kind of drawn to one versus drawn to another. Like in my personal experience, when I was going through med school, one of the first thing they tell us is like, okay, you're gonna be either drawn to working in a hospital or an outpatient clinic. Some people are drawn more towards surgery versus like non-surgery. And not that one is right and one is wrong. It's just kind of like which one matches your personality a little bit more.
Yes, that's why I liked both fields, because they're both very different. They kind of balance each other out. And then I wouldn't get so burnt out in the ER, because that's a very common thing. It's extremely busy, it's very tough, but you're working in this amazing environment of an entire team approach where you're not always just by yourself independently. You're working with techs, nurses, physicians, all the other staff together to sometimes help, treat one single patient. And so I love the team approach. And then in aesthetics, I can have more of kind of like an independent practice and just build these like long-term relationships, which I felt like I was lacking in the ER. But in the ER, it is so tough that you really have to start believing in yourself and believing that you can, get through any particular case. Keep moving forward. The door never stops revolving. So there's no time to kind of like have downtime. You're just constantly seeing patients and just moving in a super intensive flow. For a lot of times, they're 12-hour shifts and very few breaks, very little downtime. But I still love the ER so much. It was just a nice way to balance that by having a little slower pace, although not always slower in the med spa, but completely different. And then when I was learning to inject, I believe that because I kind of went through the motions of working in the ER, I knew that I could trust myself and that I could get through training, be confident, trust myself, but also do the work and research to understand everything that I could so that I could, make safety the top priority, whether I was in the ER or in aesthetics, and just be able to manage kind of any type of patient. I've trained a lot of injectors before, and I find that some injectors that haven't kind of worked in a hospital or worked in a little more rigorous or tough setting sometimes have a little bit less confidence. It could be their personality too, but some injectors aren't quite as comfortable like just pushing through and kind of doing all the work that it takes to really become like a master in the field. So I've basically been doing both aesthetics and ER over 10 years, kind of less ER over the past 6 years and really ramping up aesthetics. But just now in my career, after 10 years of injecting, do I really feel so skilled and so able to kind of address most patient needs that come in here. I've experienced adverse events. I've experienced adverse events in the ER, and all of those kind of interactions on top of just repeat educational courses, conferences, trainings, I still go to injector trainings, have helped me develop the skills. And I just absolutely love working in aesthetics. I miss my ER people, but I do very little ER now. Tell me about you, though, Dr. Adam.
Yeah, I mean, I'll make mine a little bit quicker because I think we've briefly mentioned it before, but I didn't know what I wanted to do initially, and I was leaning more towards sports medicine when I went to undergrad and med school, and so I was going down that route. But the way I got into it is I was working with a physician who, sports medicine doctor. He used to work with a lot of like athletes and stuff during one of my rotations, after med school in my residency. And he worked with a lot of athletes, but he didn't kind of practice the traditional sports medicine that I was expecting when I went there. He did a lot of like anti-aging therapy. So he kind of like left the sports medicine and got more into anti-aging, meaning things like PRP injections, IV vitamin therapies, that kind of stuff. And I got really, really interested. Like it was one of the things where when I did it, as soon as I did, I was like, okay, wow, this is like, this is kind of my calling. And I got really interested in it. And that was kind of the moment I decided, okay, it's probably not going to be sports medicine for me. It's going to be that whole anti-aging field. And so I got into anti-aging, kind of while I was in med school, in my residency, I should say, after med school. And that's kind of still what I do, anti-aging, because I do consider aesthetics to be a subfield of anti-aging medicine. So just kind of like you do, or used to do at least, like emergency medicine and aesthetic, I do anti-aging and aesthetics, but I see a lot of overlap between the two, and I love both. And it's kind of like a quick summary of.
I always
how
wondered
I
why
got
you were
into it.
so good at the joint injections. Now I know.
Yeah, I got into anti-aging before aesthetics. I mean, I went to undergrad in Michigan. I went to medical school in Michigan, and then I was in Florida to do my residency, just to kind of give people a little bit of a background. And it was in Florida and Miami, where I was doing sports medicine rotation. And yeah, it was honestly really, during that rotation, it was really kind of like very different. And it was kind of weird in the sense that a lot of like other students have done that rotation. And some of the students have actually done that rotation have told me, oh, it's easy because you kind of does things a little different, and you don't have to really do too much. But when I went there, I had a very different feeling about it. Like that was a rotation. I wanted to stay, like I wanted to get there like earlier, and I wanted to stay there late, and I had a lot of questions. It's kind of what you have to do. Everybody, what you said before, everybody has like a little bit of a different calling, and for whatever reason, that just really kind of clicked with me. It's kind of like what I really wanted. And so it was like very quickly that I realized, okay, this is really cool. This is what I wanted to do. Once I did it, and yeah.
That's so interesting. Amazing. And then you grew up in Lebanon?
I was born there. I grew up in Michigan. Moved to Michigan when I was still a little kid, and grew up in Michigan, which is why I went to undergrad in Michigan. I stayed there for medical school, and then after that is when I went to finish my internship, my residency, and then got more into this aesthetic stuff.
I just think it's so great that we've both found this calling because it is so enjoyable and it's so interesting to hear your background. So,
And honestly, one of the things that you've mentioned earlier, because it takes a while to really become masterful at this. Like honestly, right now you're one of the most skilled like master injectors out there. But like you mentioned, it's not something that happens right away. Because sometimes I've seen people who are interested in that field and they think they're just going to take a 1 weekend course and they're going to know how to inject. But every kind of field has its pros and cons. And one of the difficulties in that field is that you kind of have to learn a lot of things. I don't want to say on your own, but you have to kind of do your work to find, to kind of get the right education, to find the right mentor. And I was lucky to kind of come across a very skillful mentor that I believe. But it takes a while, and you have to kind of be more proactive, I feel, than a lot of other fields because, as you mentioned, you're more independent. But because of that, it's easy to kind of slack off and there isn't going to be always necessarily somebody who's going to be pushing you to become better and learn harder if you don't have that drive inside you. So because it can look a little bit like attractive from the outside and nice, but you also have to do a lot of work, and it has to be something that you really like if you want to be like anybody can, not anybody, but a lot of people can become injectors, but only some can become like really masterful at it, and those are the people who are passionate about it. They are willing to put in the work. So thanks again for coming. Always great to have you here. Hopefully you guys found this helpful. Make sure you like, subscribe, and we'll see you next week in the next episode.